What can you do for a persistent lung cancer cough affecting daily activities? A persistent cough caused by lung cancer can really interfere with your daily routine, but there are effective ways to manage this symptom. The first step is to see a healthcare professional for a thorough assessment. They will look into all possible causes of the cough, such as infections, airway blockages, or inflammation. Treating these underlying issues is key to controlling the cough. Medical treatments can include cough suppressants like soothing syrups or lozenges to calm the throat. If these are not enough, doctors might prescribe medications derived from opioids, such as low-dose morphine or codeine, which can help reduce the cough reflex. These medications need careful monitoring because of potential side effects. Inhalers or nebulized medications like bronchodilators and corticosteroids can open the airways and reduce inflammation, making coughing less frequent. If an infection is involved, antibiotics may be prescribed to clear it up. Sometimes, other medications like diuretics or anxiety-reducing drugs are used if related symptoms contribute to the cough or breathing difficulties. Non-medical approaches can also help. Techniques like cough suppression exercises, taught by respiratory therapists or physiotherapists, can help you gain better control over your cough. Physiotherapy can help clear mucus from your lungs and improve breathing. Breathing exercises, including using devices like incentive spirometers, can expand your lungs and reduce coughing. If you have specialized support, consulting with palliative care or symptom management experts can provide personalized strategies to improve comfort. Supporting measures are important too. Staying well hydrated helps thin mucus, making it easier to clear. Steam inhalation or warm honey can soothe your throat. Avoiding triggers such as smoke, strong odors, or dust can prevent coughing fits. Pacing your activities helps conserve energy and reduces the likelihood of coughing episodes worsening. In some cases, if a tumor inside the airway is causing the cough and other treatments are not suitable, advanced options like endobronchial brachytherapy may be considered. This involves targeted radiation inside the airway to shrink the tumor and relieving symptoms. Remember, working closely with your healthcare team is essential. They can help tailor treatments to your specific needs and regularly evaluate how well your cough responds to therapy. Managing a persistent lung cancer cough often requires a combination of approaches to improve your quality of life and keep you active. Always follow your doctor's advice and never hesitate to ask questions about your treatment options. Your health and comfort are the top priorities, and with the right support, you can find ways to better manage this challenging symptom.